Hi guys, how are you? There was discussion in the group, and I am also doing a course on tummy time. And so the question was, does acid reflux or can acid reflux affect tummy time? Acid reflux can change almost any form of development, but specifically with tummy time. So now I want to quickly just cover acid reflux and how it works with a child's psychology. So first of all, if you've never had acid reflux, right, it's something that's one of the only things I suffer from because of just hormones in my age, acid reflux, right? You can be absolutely fine and go into a god-awful pain that you would know because the acid is suddenly leaving your stomach. It is acid and it goes after your esophagus, right? Normally you'll get that, maybe you burp or something like this, or you have a little bit of a tummy, but it will slowly rise. There's risk of it going into the lungs. You can get pneumonia. You'll see that with sleep apnea. It can burn the vocal cords, the esophagus. It actually can reflux all the way up into, or even go up into the nose when you're sleeping. You're not meant to have anything go up in the body. Our stuff goes down. Now, I'm not a doctor. I'm just talking about for your understanding of it. And I also want to say, though, if your child has it, and I get it that you might be or have a wonderful pediatrician, there are environmental causes for reflux. Most people think of allergies, right? So even if you're, say, nursing your baby, if your baby, let's say, is allergic to potatoes, you've just had potatoes for Thanksgiving or whatever, and now it's going through your body into your breast milk, and those enzymes are going into your child, and that's where, even though they're nursing, could have allergies. Right? And the first things they'll look after is just certain food choices, especially your nightshades, coffee, tomatoes, and so forth, that are already high acid. You don't want to add to the acid. So they might say you have to have a diet elimination program, or your child does. But also it can be structural. So the diaphragm is here, let's say. This is a separation between your diaphragm is across the bottom of your rib cage, right? And that's your breathing. It's a vacuum base, but it separates your dry tissues with your lungs and stuff into your wet tissues, which is your small and large intestines, right? And so what is happening now is your stomach is right below the diaphragm. There's a hole in the diaphragm to allow the esophagus, right? And there's a valve right here that closes off the stomach. So when I'm digesting, right, these should be separate. But what happens sometimes is that stomach can just be pulled up a little bit too much. It's called a hiatal hernia, and that valve could remain open, right? So when that valve is open and you go to place your child in a horizontal position, now you're just, gravity's taking in and it starts going up the esophagus. So this is where you'll hear stuff that you might have to tilt your baby's crib, let's say, or your bed. If you've got reflux, that's one way of doing it, is to elevate the child so you have that. And then you'll also go into, again, the tummy time, what is going on. So right now here, I might not have any acid reflux, and this is where we get colic, right? And I've got to hold my baby all the time. Why? Because you've got to keep your baby up so that acid doesn't come out. Acid reflux does not necessarily mean vomiting. That's when the stomach contents are just coming all the way out, right? Now, my son not only was a professional vomiter, but he had for 3 years Haemophilus influenza and staph all through the base of his head. I've taken my kid into the hospital. I really should have an interview with Phoenix Children. We don't treat fussy babies. My son had been screaming for over 2 days. Screaming, not screaming. I finally, you know what I mean? Like, because I was not getting the help from my medical community, right? And they're like, we don't treat fussy babies. Going back now, when I tell a doctor my son had Haemophilus influenza and staph for 3 years, nephnoid, septoid sign, they look at me like I'm daft. I've been through Phoenix, Tucson, UCSD, all the way to Dr. Haas. I don't mean to throw names, but sometimes you just get a little frustrated. And National Jewish. And they all were like, he's got autism. What, you'll have different diagnoses maybe in your life, and maybe you won't. You're not here for the diagnosis. You're here to help your child move better. And, you know what I mean? Like, are you out of your mind? Anyway, So that's my mom's side coming out, not Michelle at Movement Lesson, but I'm here for a reason, guys, you know. And so when I say you need a second opinion, I've been to 26 doctors, you know what I mean, 4 ears and throat, you know, he said 5 sinus surgeries. You know, tell me why they didn't do culture in the previous 4. I can go on. He's had 15 surgeries just in his head. So, and I'm not here to get the medal either. I'm here to offer you a quicker path on how to help your child. So when you go to offer your child tummy time, now we have, don't sleep your child on their back. That's not what, again, I'm promoting. We need, don't sleep your baby on the belly. You want to promote the back sleeping. But at the same time, they need that experience. I've more than posted my sensory mat that in this position, a baby in 1 minute will make 1,800 movements, 1,800. That's crawling, right? These are all of these things. Your back needs to breathe. It works on your head shapes. It works on your fine motor skills, because first what has to happen is the weight transfer, etc. Now, again, like I just mentioned, if your child has acid reflux or a hiatal hernia, let's say, or a structural issue, I'll be covering this into laryngomalacia in the next video, but they cannot get themselves out of this position at this stage of life. So what happens is, in a sense, they feel like they're drowning. They want to breathe, they can't get the breath in because the acid is hitting up. So you'll get more of that because the opens up the airways, right? Crying is not always crying, but crying is what they know, right? It's sort of like if I had to talk to you, but you only use 5 words. You know, you're right. They have a limited movement vocabulary. They have a limited vocabulary. So what are they going to do is you're going to scream, right? This is different than, you know, just because your child's whimpering a little bit, let them have their voice. But there's a scream that happens is, get me out of here, right? It's not a, I'm tired and this. And this is where we get confused, because it's like, oh, my mom said keep their baby in their tummy for at least, 20 minutes. Well, if they're in a position where it hurts them or they find difficult, right? For a baby, that's the same thing. They won't do it. If I wake up, my back doesn't hurt, I still have to come to work, right? If you hurt your ankle, you still have to take care of the family, let's say, right? We have our levels of what we go into. With a baby, it's 0. Right? If it hurts them or whatever. So now that's where I get the conversations. My baby hates it. My baby doesn't like to be in tummy time. Okay, first of all, again, they're very young, so there isn't that kind of emotional attachment. They're doing it for self-preservation, right? And you have to listen to that language. So again, that's what you're going to start doing is there's no way I can get my baby in tummy time. And honestly, if you have a bad reflux, your tummy time might start here. And you might actually have to start going almost horizontally just for them to experience that transition to the floor. But they do it in a way where they have comfort in your arms and your breathing and so forth, versus in always being in a horizontal position. You might have to take them over the leg. And all of these things I'm showing you how to do in the Tummy Time course, which will be available in the new year. I'm working on that now. But anything that your child finds that hurts them or possibly is difficult, they will not even transition into the movement. And that's the key with any movement, is transition. It's not to say, oh, my baby's doing tummy time, I'm putting their hands up. They're doing tummy time. They have to be able to transition, let's say, from vertically to horizontally. They have to learn how to transition from their back to their belly, right? The transition is key. And when your child is not transitioning in and out of a movement, those are really those first key warning signs that are available to you through their language of movement. And if you're not sure of, post the video, ask a question. But that's just to talk about, again, some of the reasons where acid reflux can affect tummy time. If you feel at all that your child needs to be helped, right, please schedule your doctor's visits. However, if you're not new to our world of special needs, and again, you don't have to be special needs to have acid reflux. I don't mean to go there. there are specialists for every body part. You have your cardiologist, you have your neurologist, and you have your gastroenterologist. It could take, let's say, up to 3 months, especially with COVID, to get in as a new patient. If you feel for any reason that you need help, make the appointment now. You can always cancel it, closer to the appointment, but get in, right? Get your appointment in. Don't wait till it's almost too late, and then you expect to see them, next week, and even though. If you are really in a situation, the best thing is to call the office manager and tell them, and even if you have to put on a boo-hoo and say, I'm really concerned, I have a baby, X weeks old, maybe they were premature or whatever, I need to get in to see if that can help, or your pediatrician who you're going to should be able to make that phone call, right? And to get you in sooner, right? You have a right to be heard. You have a right to be heard as a parent. I'm not trying to turn everybody into a hypochondriac, but at the same time, if you feel something is up, you have a right to find an answer, right? They're your babies. So I hope this helps, and I'll see you in a little bit, but thanks. Bye, guys.